Actually, hemiplegia is required in pediatrics as well as in medicine also. That's why we will discuss the hemiplegia on the basis of these two things. What will you do and what is that? The hemiplegia means paralysis of one-sided limbs, upper and lower limbs. Paralysis of upper and lower limbs of one side. If it is in the right side, it is right-sided hemiplegia. If it is in the left side, it is left-sided hemiplegia. There is another term that is called hemiparesis, means weakness of the upper and lower limbs. Weakness. Paresis means weakness. Paraplegia means paralysis. The question is, why the key যাচ্ছে? ঠিক আছে, ব্যাটারির দরকার নেই, আপনি চলুন, মুখেতেই চলুন. The question is, why the trunk is not involved? You can ask me, the upper limbs and lower limbs of one side is involved, but the trunk is not involved. Okay, this is one thing, and another one thing is that the proximal muscles are less involved in comparison to distal muscles. So axial muscles and trunks are less involved, or trunks are not involved. Proximal muscles are less involved in comparison to distal muscles in a case of hemiplegia or hemiparesis. The reason is that the trunk and the proximal axial muscles, they are bilaterally supplied. Answer is clear? They are bilaterally supplied. So if there is any lesion in the left side, there will be weakness of the right side. So there will be hemiplegia or hemiparesis. But truncal muscles, they are getting bilateral supply. So they are getting supply from the left side and right side. When the left side is weak, then right side will give supply to truncal muscles. So trunks are not involved in a case of hemiplegia. Second important thing, in a case of hemiplegia, distal muscles are more involved in comparison to proximal muscles. That's why during recovery of the hemiplegia, during recovery of the hemiplegia, it has been found the proximal muscles, they are recovered fully, whereas the distal muscles, they are poorly recovered. So remember, in a case of hemiparesis or hemiplegia, the distal muscles are poorly involved. There is weakness of the fingers, they will persist. This is one thing. Third important thing is that upper limbs and lower limbs. The upper limbs are more involved in comparison to lower limbs in the case of hemiplegia. Is it clear to you? So in a case of hemiplegia, upper limbs are more involved in comparison to lower limbs because the upper limbs fibers are more in number in comparison to lower limbs fibers. So there is a picture here also. When I will show you, you will see the upper limbs, face, thumb and the hands, they cover the large area of the brain in comparison to the legs and so that is the reason the upper limbs are more involved in comparison to lower limbs. Takes everything has some reason. Nothing is unexplained. There is reason everywhere. So let us go to the, now hemiplegia is there with alteration of the sensorium and convulsion. Hemiparesis, hemiplegia is there, and if it is associated with convulsion, then definitely the cortex is involved. Is it clear? So if you are asked in the case of hemiparesis or hemiplegia, the history of convulsion is there, then definitely the cortex is involved. So you can easily find out the lessons in the case of hemiparesis or hemiplegia, asking the simple question, is there any convulsion in this child or convulsion in this case? If the answer is yes, then it indicates there is some involvement of the cortex. But there may be other causes of convulsion in children, suppose it's sugar fall or other things. So there is different things. But in relation to this context, in relation to neurological concept, the convulsion in children associated with hemiparesis involved usually focuses that there is involvement of the cortex. Second important place of lesson is the internal capsule. You know all the fibers which are coming from the brain. Suppose one side, left side or right side of the brain, they are radiating in the initial nature. They are called coronal radiata, and they converge together and pass through the posterior limb of the internal capsule. So, internal capsule is a V-shaped structure like this. It is anterior limb, genu and posterior limb. Through the posterior limb, the fibers, the motor fibers, pyramidal tract fibers, they are going to the posterior limbs. These posterior limbs of the internal capsule is supplied by usually the Charcot's artery from the middle cerebral artery. Middle cerebral artery, branches from the middle cerebral artery. Okay. It may get supply from the posterior cerebral artery to some extent, but it is bulk supply from the middle cerebral artery and anterior cerebral artery usually do not give supply to the posterior limb of the internal capsule except in one condition. This is for postgraduate dental question, recurrent artery of Hubler. It is present in 50% of cases and it may give supply to the anterior from the anterior cerebral artery. So, what is the main source of supply to the internal capsule? It is the middle cerebral artery. Middle cerebral artery. So, if there is any block in the middle cerebral artery by thrombosis or embolism, or the middle cerebral artery ruptured, giving rise to hemorrhage, the internal capsule may be affected, and the Charcot's artery Charcot's artery branches of middle cerebral artery, 5 or 6 in number. They are usually under high pressure. So, if there is any fluctuation of pressure, if there is sudden rise of pressure, then they can rupture and giving rise to cerebral hemorrhage. That's why they are also called the Charcot's artery of cerebral hemorrhage. Okay. Now, what may be the possibilities of the hemiplegia? Let us take our common sense. Common sense. Usually, the children are very much habituated with keeping something in the mouth. Something in the mouth. Pencil, pen, something in the mouth. And they can injure the tonsillar fossa also. And if you analyze the relation of the carotid artery and tonsillar fossa, carotid artery comes in the lateral boundary, lateral border of the tonsillar fossa. So, if there is any injury in the mouth cavity, particularly in the tonsillar fossa by some say pen pricking or pencil etc., that can give rise to the damage of the internal carotid artery. That damage may give rise to formation of thrombus that may be dislodged. So, that can give rise to these things. This is one of the important causes in children. Second important cause is that now something present in the heart, particularly cyanotic heart disease, ecology of Fallot's, transmission of gate arteries, etc. In cyanotic heart disease, usually because of the cyanosis or hypoxia, there is polycythemia, increased RBC number. And when there is polycythemia, the blood flow is disturbed. Normally, human can adopt the polycythemia up to 65%. Or rather, it should be told as 63%. If it is more than 63% RBC, then the blood supply will be sluggish, slow supply. Sometimes they can give rise to thrombus manifestations, particularly the children below the age of 2 years, because they are not very much adaptive. For example, in case of tetralogy of Fallot's, when there is cyanotic spell, a children above the age of 2 years, he can either sit or lie down or sit on the chair, etc. But below the age of 2 years, they cannot do it. They cannot understand. That's why also the cyanotic spell is much more common below the age of 2 years and more preferably below the age of 1 year. So there is more and more hypoxia and there are more and more chance of less blood supply, viscosity is higher, and that can give rise to thromboembolic manifestation in the case of congenital cyanotic heart disease. Is it clear? This is important cause. Third important cause is that if there is any arrhythmia, say atrial fibrillation, cardiac atrial fibrillation or atrial flutter, etc., the small thrombi which are present in the wall, they can dislodge, give rise to this. This is heart-related cause. Third important cause you should consider in both children and adults, the infection, particularly tuberculous meningitis or pyogenic meningitis or meningoencephalitis or scab typhus meningitis, whatever it may be, that can give rise to thrombus formation, and that can give rise to block. We have vessels, middle circulatory vessels, and that can give rise to hemiplegia. This is important thing. So if there is any block in the artery due to thrombosis, and thrombosis is generated due to some infection, that can give rise to hemiparesis or hemiplegia. I am discussing this common sense. From common sense, you can answer these other causes and why they are happening. Okay. Next important cause you saw, suppose there is some trauma, fracture femur, and from that trauma there may be some fat embolism. So that can give rise to hemiparesis. Okay, trauma also one of the important causes. Next, other important cause, suppose there is a child, a female, more common, they suffering from collagen vascular disease, say systemic lupus erythematosus. There are more and more phospholipid syndrome, you know that. There will be more and more thrombus formation that can give rise to hemiplegia also. In case of, say, Kawasaki disease, the middle cell vasculitis, middle vessels vasculitis, Kawasaki disease, or other vasculitis syndrome, there is chances of damage to the vessels, and that can give rise to it. So anything which is damaging the vessels can give rise to this. Let us consider another thing, that is a homocystinuria, a metabolic disorders. Homocystinuria is a metabolic disorder. That can give rise to, because of the increase more and more thrombus formation chance, that can give rise to hemiplegia also. Let us go to the hematological cause. A sickle cell anemia. Sickle cell anemia, you know the sickle cell anemia, there is sickling of the RBC. So RBC lost its biconcave shape. RBC is just like a sickle, kastel moto hoye jacche, and there is loss of biconcave shape. And because of that, they cannot flow to the small vessels. They cannot adapt. So there is chances of blockage. So in case of sickle cell anemia, there are chances of the blockage, and that can give rise to blockage of the small vessel. Not only hemiplegia, it can give rise to other manifestations, say in blockage in the kidney, renal vessels can give rise to hematuria. Blockage in the, say, skin vessels can give rise to vasculitis-like syndrome. Blockage in the brain, there is hemiplegia. Some small hemorrhages may be there everywhere. Okay, so that may go on. So these are some examples of how the hemiplegia may occurs. Let us go into details. Another cases, another important thing which I should mention, particularly in case of pediatric age group. Suppose a child is a newborn baby, he just after birth, say it is suffering from severe birth asphyxia. So there is a baby in our hospital admitted in the NICU. The baby is delivered in a nursing home in the Bolpur 2 days back, and that baby developed severe birth. Well, see, baby did not cry, baby developed respiratory distress. Baby is referred to subdivisional hospital, and they again referred to the baby to here. And here the baby is now under ventilation. Baby was given surfactant therapy yesterday, and there is a whiteness of the lung in the both sides. Left side there is more whiteness, and right side is more whiteness, except. So severe respiratory distress syndrome. I am not discussing the diagnosis. It may be, say, RDS, maybe, so it is, the baby is mature, you should not tell it hyaline membrane disease. So it's a respiratory distress, and that may be due to congenital pneumonia or some sort of, say, congenital surfactant deficiency or other causes. Surfactant given, and immediately baby responds to that, and now 2 days baby is okay. From the death end baby is coming back. During this time, there are every chance of, during this time, because of the hypoxic stage, there is every chance of damage to the brain blood vessels, and there are chances of thromboembolic manifestation in the brain or vascular small vessels may be blocked, and there may be hypoxic ischemic encephalopathy. Hypoxic ischemic encephalopathy, and one of the important cause of hemiparesis or hemiplegia in the children aged of 1 or 2 years of age. Okay. So these are the important causes of hemiplegia. There are lots of other causes are there, and I can tell you another cause which is previously thought it may be more common in Japan, but we have seen several cases in London of Muhammad disease. Muhammad disease where the carotid artery is narrow, where by some unknown reason, genetic reason definitely, carotid artery is narrowing, and because of the narrowing there is anastomosis is formed. That is called Muhammad syndrome. I will show you the picture of Muhammad, and half of blood vessels in the brain. That can give rise to hemiplegia. Sometimes hemiplegia may be in the right side, or sometimes maybe in the left side. So this is called alternating hemiplegia. It means sometimes there is right side, sometimes there is left side, alternating hemiplegia. This may occur in Muhammad disease as well as in case of migraine. There are some migraine where the headache is severe, vomiting is there, and some vessels are there, spastic conditions. That can give rise to also hemiparesis. Well, so, and that hemiparesis may be alternating in nature. So if you are asked in the exam for honors marks or others, what are the causes of alternating hemiplegia? One answer may be Muhammad disease. Second answer may be some sort migraine may be one of the cause of this alternating hemiplegia. There is another cause of alternating hemiplegia that is called channelopathy. There is disturbances of the sodium-potassium entry in the cell membrane. You know the cell membrane requires the sodium-potassium balance, that is called transmembrane potential, and in the brain cell membrane it is about minus 70 millivolt. In RBC it is minus 9 millivolt. Right? In the muscles it is 70 millivolt. So this transmembrane potential is very much essential for maintenance of the Donan's equilibrium. It means internal and external environment osmotic pressure. So if there is any damage of this transmembrane potential, due to the damage of due to leakage of the sodium or potassium, due to channelopathy, with genetic disorders, there may be the channelopathy can give rise to some sort of hemiplegia because of the vessels damage. Okay? So that can give rise to alternating hemiplegia. These are the important causes of hemiplegia. Let us go to the slides and see the pictures of different hemiplegia. So you see, we have discussed all these things. It may arise from the congenital malformations. Yes, there are some congenital malformations. Suppose if there is some, say, lots of congenital malformation, there will be hemiplegia may be presentation. We know we should not discuss the development of brain now, but we should say that brain, gray matters of the brain is moving from the ventricular wall. There is proliferation of the cells in the ventricular wall. They are moving outwards to form the gray matter. This is the most simple example. If that gray matter is somehow disturbed, the size of the cells or the gray matter is not properly passing there, the gray matter amount, size of the cells and other things may be disturbed. One of them is called the polymicrogyra. Polymicrogyra, it means the gyra cells are there very small in number and a large number of gyra cells are there. Gray matter cells, gyra cells are there, and if you look at they are not functioning properly, that can give rise to, suppose the gyra cells are disturbed in the left side, hemiparesis may occur in the right side. Okay. There is another problem is called the cyanotic, where there is a cleft inside the brain. That cleft may be open or closed. Closed means cyanotic cleft is not connected to the ventricle. That is called closed. Open means they are connected to the ventricle. If the cyanotic is present, that can give rise to this. Sometimes there is another thing that is called polencephaly. there is some black cavity at the lateral side of the ventricle. Mostly seen in case of preterm baby. In preterm baby, because of the say periventricular hemorrhage, there is, after absorption of the hemorrhage, there will be a cyst-like presentation there. A large subarachnoid cyst can give rise to hemiparesis. So lots of other conditions may give rise to this. So I will not discuss these things. Let us go to the. So you see the hemiplegia may be of the congenital or acquired causes. Let us go to the next slide. So this is very common in case of hypoxic ischemic encephalopathy in children. Usually there is developmental delay, and suppose the right side is weak and you are giving a toy to the child. So child will take the left side. You can easily diagnose. And that will occur before the age of appropriate hand papyrus development. Hand papyrus develop at the age of 3 years. Suppose you are examining a child of 2 years, and you see always the child is taking the left side, not the right side at all. And also you are seeing during your examination the right side is not using, child is not using the right hand properly. You can easily diagnose that case of that developmental delay child is suffering from hemiparesis of the right side. Hemiplegia may be progressive also. Suppose there is a brain tumor. Suppose there is a brain tumor compressing the brain. Progressive in nature, hemiplegia is progressive. Right now. And depending on the site of the lesion, hemiplegia there may be involvement of the dense hemiplegia. It means the facial nerve and the right upper and lower limbs. That's called dense hemiplegia. Usually occurs in case of internal capsule lesions. But may occurs in children in lesions of the cortex also. Now another thing is that if the hemiplegia is there in the midbrain lesions, what will happen? There will be involvement of the cranial nerves. We know that in the midbrain there are third and fourth cranial nerve. So any tumor arising from the midbrain or any lesions in the midbrain, third or fourth cranial nerve may be affected along with the hemiparesis of the opposite sides. If there is involvement of the pons giving rise to hemiparesis and the pontine manifestation, you will get the involvement of the nerves which are taking origin from the pons. That is 5, 6 and 7th cranial nerve. Okay. Along with the features of pontine lesions, pinpoint pupil, etc. I am not discussing this. If the hemiplegia occurs in medulla, you will get the rest of the cranial nerves may be involved along with the. There may be alteration of the respiratory function, cardiac function, etc. as these centers are present in the medulla. So in this way, you can find out the site of the hemiparesis. If there is any question, a long question, very large question, the patient child presented with this and this, or an adult aged 20 years presented with this and this, and all the features of is described which is related to particular brain lesions, then said this hemiparesis or is the site of lesions. So you consider all these things and then the answer. Acute hemiplegia means there is sudden onset. Usually there is some say vascular stroke, embolic manifestation or thrombotic manifestation or hemorrhagic manifestation. Remember, the thromboembolic manifestation is much more common than hemorrhagic manifestation. Right now, thromboembolic manifestation is much more common than hemorrhagic. They are about say 70-30 ratio usually. So that is your discussed last now. Hemiplegic cerebral palsy. The term used, just remember the term, child is presenting with developmental delay along with the hemiparesis one side. And there is history of some say delayed cry, etc. That is called hemiplegic cerebral palsy. I have discussed these things. The premature baby, there are every chance of hemorrhage in the periventricular regions, which can give rise to some problem, give rise to hemiparesis. Convulsion or epilepsy is associated with the hemiplegic cerebral palsy. Reason is very clear because here is the cortex is damaged because of hypoxic ischemic encephalopathy. Whenever there is cortex is involved, there are chances of convulsion. When the cortex is involved, chances of convulsion is there. Speech and language develops in the Broca's area. Speech and language is developed from the various areas that are involved, but the most important thing is the, say, if I analyze these, you are listening in the temporal lobe, superior temporal gyrus, you are sending the impulse to angular gyrus processing areas, that is area 39 as the temporo-occipital and parietal junction. And after analyzing the sound which is coming, you are transmitting that sound to the via the arcuate fiber to the Broca's area 44 and 45. And from the Broca's area, there is some impulses are going, and that is stimulating your larynx, laryngeal parts, your chest, and other muscles involved there. That is called speech production. Lesions anywhere can give rise to this. We are discussing, suppose there is lesion in the left frontal cortex of the area of the Broca's area. In the Broca's area. So will the child is able to speak later on? Answer is yes. Child can speak later on because the right hemisphere will take the action. Right hemisphere will take the action. But there is some special problem is will be there. There is special disorientation will be there. That is, child is not able to draw a figure, geometry, poor will be geometry or other space recognition. Okay? So this is the thing which is here. That is discussed. What is perinatal strokes? From 28 weeks to 28 days of life, that's called perinatal stroke. I think this is not required for you. Size are there, that's why I'm telling this. I have discussed the middle cerebral artery is the most important part of this. This is the perinatal stroke. Any problem with the mother can give rise to stroke in the baby. Mother suffering from preeclampsia or any disease suffering from mother, hypertension, etc., can give rise to stroke in the baby if there is delayed presentation of other things. Congenital heart disease, particularly cyanotic heart disease, can give rise to problems of the hemisphere. Acute hemiplegia in children. These are discussed. It may be vascular, either ischemic or hemorrhage. Okay. Or it may be due to, say, epilepsy can also. Epilepsy means convulsion. Convulsion associated with the lesion in the cortex. That can give rise to hemiparesis. But not all convulsion cases associated with hemiparesis. Remember this. There may be convulsion without hemiparesis. That is a different thing. This is the usual sign of any hemorrhage is there. It's considered the hemorrhage showing the hemorrhage and compressing this. And if you look at the hemorrhage side, the periventricular hemorrhage, this is the ventricle, side of the ventricle. Ventricle is pushed to the lateral. There is intercerebral hemorrhage. Not periventricular, intercerebral hemorrhage, though looks like ventricle is pushed to the opposite sides. Hemorrhage. Lots of other manifestations will be there. Along with that, there will be hemiparesis. We have discussed all these things, either it may be artery or sometimes venous thrombosis. Sagittal venous thrombosis can give rise to also compression and give rise to hemiparesis. What is this? This is the important thing, maybe given for your PG entrance examination for just picture, radiology. Now this is the carotid artery, and carotid artery is narrowing. Because of the narrowing of the carotid artery, there is tuft of the vessels anastomosing here and there. This is called Muamua syndrome, Muamua disease. More common in Japan, it can give rise to hemiparesis. Muamua disease. It needs correction, it needs operation, remove these and connecting the vessels together. Okay? It should be operated, removing these vessels and then reanastomose the blood vessels together. Okay? No. One of my very known young men is doing this in Birth Hospital, London. He is doing this, and there are lots of papers in Muamua syndrome and correction. Also, at a vein of Galen malformation and correction. So they are doing this, no problem. So I have discussed this, why this has happened. We don't know what is the cause, it may be genetic cause and other things, but that may happen there. Recurrent hemiplegia. Recurrent hemiplegia may be presentations, maybe alternating hemiplegia, not only one side, convulsion and other things. This is also discussed just before. Channelopathy, ATP formation is disturbed, sodium potassium channel. Okay? Migraine, I have discussed this. Migraine, sometimes left side, sometimes right side, there is headache, vomiting, visual disturbances. Migraine also one of the important cause. Torts paralysis. This is important one question, torts paralysis. Somebody is suffering from convulsion, after convulsion there is weakness of the one-sided limb. That is called torts paralysis or torts paralysis. Remember, this paralysis will not persist more than 24 hours. তাই তো, no? 24 hours পর তো ঠিক হয়ে যায়. Maximum 48 hours. This weakness will not persist. We have seen the cases of epilepsy presenting with the weakness of the one side. After 24 hours or 48 hours, the child is okay. Okay, that's called torts paralysis. Even it may occur after febrile convulsion also. One-sided paralysis weakness. Though not very common. Congenital heart disease, I have discussed why the risk is there. Because of the increased RBC, there is polycythemia and there is thromboembolic manifestations. This is the important thing. Hypercoagulable state. Homocystinuria, one of the important cases. Protein C and protein S, there is deficiency. If there is deficiency, there is hypercoagulable state. So if there is hypercoagulability, there is thrombus formation. Right? There is thrombus formation that will spread and that can give rise to hemiplegia. Sickle cell disease we have discussed. Why there is sickle cell disease giving rise to this? Narrowing, the cells are sickle-like and they are not adapting to the small vessels passing. Normal RBC cell is biconcave in nature. Normal RBC is biconcave in nature. In sickle cell, the cells are sickling, so there is poor passing of the vessels and there is obstruction to the vessels. Management is not required, you know all these things. Systemic vasculitis, I have discussed anything of vasculitis anywhere. Anywhere vasculitis is there, that can give rise to the obstruction, vasculitis. Infection, we have discussed any sort of infection, it may be vein abscess, tuberculous meningitis, pyogenic meningitis, encephalitis can give rise to this. Now, look at this picture of the brain abscess. Picture of the brain, this is the abscess in T1 image, this is T2 image, both are same. They are the brain abscess area, and definitely brain abscess is compressing the cortex, and that can give rise to hemiparesis. This is another thing you see, this is the space occupying lesion. Space occupying lesion, and that can give rise to compression, and that can give rise to hemiparesis. Any space occupying lesions in a brain tumor, if it is pressed, lots of things may happen. It may give rise to hemiparesis, it may give rise to alteration of sensorium, it may give rise to convulsion, it may give rise to vomiting, headache, and there are chances of herniation also. I think you know about the different types of herniation. Right? Herniation, then herniation is very important, you should know it. The herniations. Definitely brain tumors, brain abscess, or any lesion can give rise to this. Another important thing which I failed to mention till now is the neurocysticercosis. NCC, neurocysticercosis, tinea solium, eggs they are present in the brain, and sometimes they are present with the convulsion. Neurocysticercosis. Or tuberculoma. Tuberculoma can give rise to convulsion. Scap typhus can give rise to convulsion, Rickettsia groups. Neurocysticercosis, I forget to mention, that can give rise to convulsion. And actually, a large number of cases of convulsive disorders may be due to neurocysticercosis also. In one study, it is reported about 20 to 30% cases. So it may not actually be there. This is one thing. You see the child baby. This is the baby who just one side of the face is red, and there's hemangioma. And in this baby, if you examine the brain, you see the calcification, trum-like type of calcification inside the brain. This is called Starch-Weber syndrome. Starch-Weber syndrome. Food আলাদা সেটা এটা না Starch-Weber syndrome, it can give rise to convulsion, huge hemangioma and convulsion, one side of the body and then convulsion. Starch-Weber syndrome. This picture may be given. This type of picture may be given in the exam for the picture radiology. ঠিক আছে? Starch-Weber syndrome. STURG. Starch-Weber syndrome. হ্যাঁ? ও সেটা ঠিক আছে, আমি শুনতে পাই না। ঠিক আছে, আলাদা একটা নাম আছে, ঠিক আছে। Starch-Weber syndrome মনে রাখবে, Portwell-Stein, ঠিক আছে। ও Portwell-Stein বললে হবে না, মনে রাখবে Starch-Weber। ঠিক আছে? Term line calcification inside the brain. This is also discussed. This site also discussed before. A child is taking the pencil, and there is some trauma in the neck, giving rise to injury to the carotid artery and tonsillar fossa. And tonsillar fossa lateral boundary is carotid artery. There is damage of the carotid artery, and thrombus formation may be there. Okay? Any type of damage to the carotid artery can give rise to thrombus formation. Intima may be damaged. Okay? And there is platelet aggregation. This is also discussed where you get the weakness. If the cortex is involved, which part of the cortex is involved, what are the representation of that part of the cortex, that depends on the manifestations. Okay? Usually convulsion is associated with hemiparesis in the case of cortex involvement. In case of internal capsule involvement, convulsion may not be there, but dense hemiplegia is upper motor neuron type of lesions of the site, opposite sides, and the hemiparesis. This is the important thing. Yes. In case of say below the level of the lesion, say midbrain, there will be involvement of third, fourth cranial nerve. In the pons, there will be involvement of the cranial nerves in the pons. In medulla, involvement of cranial nerves in the medulla. These you should tell in the during examination. তুলে দে একটু, তুলে দেবে। শুনেছ? ঘুমিয়ে পড়েছ? ঘুমল হয়? পরে তো এইটাই বলে স্যার কি কোশ্চেন জিজ্ঞেস করলা? বলে কিনা ক্রস হেমিপ্যারেসিস জিজ্ঞেস করলো, কোথায় কি, এতে এমডি লেভেলের কোশ্চেন এইসব। এখন একটু শুনে নিলে তো এটা হয়ে যায়। ঠিক আছে? So cranial nerves may be involved this. So this is I have just discussed how it is representative. This is the why I have told you the upper part, the upper limbs is more involved in compared to lower limbs. Just see the picture, you can realize this. How much area for the upper limbs is taken? Almost major part, and this is the lower limbs. These lower limbs in paracentral lobule it is present, And there is one artery which supplying the paracentral lobule. That is called anterior cerebral artery. This paracentral lobule is supplied by the anterior cerebral artery. ঠিক আছে? So if there is any blockage in the anterior cerebral artery, বুঝতে পারছো? You will get the weakness, flaccid paralysis of the lower limbs. And as the bladder control is also present. Higher control of the bladder is present here. So there is loss of the bladder control also. So in case of say if a person present with the sudden onset of acute flaccid paralysis along with the loss of bladder control, which artery in the brain may be involved? This is the anterior cerebral artery because it supplies the paracentral nerves. Okay. MRI is important investigations. MRI. Sometimes a CT scan cannot give this to this. Also, radiation is also a hazard in CT scan. MRI investigation is very important because it has very least radiation. We can detect it. What is the type of the damage? MRI has different types of image, plain image, diffusion related image, etc. So flare enhanced image, etc. We will not discuss about the MRI, but what we should see that these are the area, these are the type of things you can see here. Look at this. In this area, there is some area which is comparatively more amount of water here. Right? This indicates the ischemia, cortical ischemia. So cerebral ischemia is there. And if you take diffusion related image, if you see, this is highlighted like this, very clear cut. So there is a different pattern of MRI image. And if this type of image is present, the radiologists usually give you another image that is called diffusion image for clear cut demarcation. So this is how there is some damage like this. In pediatrics, we have seen the large number of cases where there is some hemiparesis management with this type of presentation in the brain. And after a few days, 7 or 8 days, when the block is removed, then brain is already normal and everything is clear. Angiography or say the angiography is used to say any arterial problem, either moa or say some vasculitis or stenosis. You can do the angiography also or CT angiography. These are the different types of things you see. You can see the angiography and you can read the diagnosis also. Okay. The blood vascular manifestation like this. I have shown you these pictures what is the narrowing of the vessels and how there is multiple say disorganization of the blood vessels. That can give rise to hemiparesis also. You should evaluate all the things. All systems should be investigated, starting from the eye, starting to cardiovascular system, starting to kidney, renal system also. Suppose there is some acute nephritis, there's a very high blood pressure, that can give rise to some cerebral encephalopathy also. So all systems in echocardiography and cardiac examination should be needed. Say collagen vascular disease should be excluded. So depending on the basis of the clinical lesions, clinical examination, you should detect what is the type of lesions there. Management, mainly supportive management is there. We do not propose any thrombolysis management in pediatrics. We should not give it. Or any say anti-thrombosis, usually anticoagulation we do not recommend for the pediatric use till now. Okay, until and unless it is recurrent thromboembolic manifestations, we do not usually give any anti-thrombic management in pediatrics. Is that it may be given in the adults. Seizure management is important because seizure management is convulsion management. Because every seizure damages the brain to a new extent. If you can control seizure, brain may recover quickly. If you fail to control seizure, then there is more and more damage to the brain. Now, what are the things we should do? You give some therapy, either say physiotherapy, occupational therapy means to do something on the occupations, use of the tongue, use of the say hands, use of the legs. So these therapies, they can help. And you know that there is some say brain is neurological system or any system in our body is huge capable of adjusting. Right? That is called plasticity. Plasticity. Anything. Everything is under plasticity condition. So only desire is the most important thing. You should think of, I should do it. If you think of, I should do it, your subconscious brain will take it and they will try to do it. You just think of that I will do it, your subconscious mind will take it and stimulate it. Okay? Suppose you are thinking I should get very good marks in pediatrics. So your subconscious mind will take it and it will guide you to read more and more pediatrics and you will gain ultimately. Okay, this is the rule. So there is neural plasticity is very important. But if you think that it's a very dull subject, very small baby, very difficult, they are always crying, etc., your subconscious mind will reject and you will go to other say adult section or say other lines. So everything is that. So on the basis of that, the plasticity, neuroplasticity, the therapy concept is there. All these therapy concepts are based on neuroplasticity. Physiotherapy, occupational therapy, or say speech therapy, all are based on the neuroplasticity. So I will give you one example of the speech therapy. Suppose in the speech therapy, one of the tactics is that collect some pebbles, small beautiful pebbles, and ask the child to take the pebbles from one place and keep it to another place. This is one therapy, speech therapy, one part. What is the basis of this? When you ask the child to take the pebbles with your fingers, and your fingers are very close to the focus area, so finger area will get more blood supply. Remember, finger area will get more blood supply, and to some extent that blood will also go to the focus area. So that utilizes this method. Okay. And another thing is that the mirror neuron concept. When you ask the child, you do these things, tell these things. Tell A. Child is telling A, or failing to tell A, but child will try to A. Remember, when you say the child to tell A, your focus area is excited. At the same time, who is listening the word, their focus area is also excited. I am giving you a lecture on hemiparesis. Those who are listening carefully to my lecture, their brain area is also excited at the same level. They are getting increased blood supply at the same level. What I am showing you. If you examine my brain, the blood supply of that particular brain, and your brain is also, those who are attentively listening, their brain also excited the same things. This is called mirror neuron concept. And this concept gives us to a revolution in the management of neurological diseases. Okay? And one of that is therapy. Spasticity you can manage with the baclofen, you know the muscle reaction, you can give diazepam, but it's sedative, that's why it is avoided. And also you can give the botulinum toxin, usually we not use. These are intrathecal therapy in severe cases, means a posterior rhizotomy, sensory nerves are cut. So these are not very important. Effective epilepsy, hemispherectomy, these are not important to us in neurosurgical matter. Psychological support and parental counseling essential for managements. Let us do to the last thing, that's questions. Questions for you. And I think the questions for you, the seizures on day 3 of life, later developing right hemiparesis. আমি চলে যাই লাস্টের দিকে। তুমি What's the answer of this case? Case 1, seizures on day 3 of life, the new neuron cured, and then developed hemiparesis. Seizure মানে convulsion. কিছু বলবে? বসো এটা কেস দেবে পরীক্ষা গো। নিউরোটাল স্ট্রোক, এটা বলা উচিত ছিল বলো। নিউরোটাল স্ট্রোক, তাই না? কেস 2, তুমি এই কি বল, এটা কি লেখা আছে? 6-year-old child after neck trauma presenting with acute left hemiplegia. এই তো একটু আগেই বললাম রে, নেক ট্রমা খুঁচিয়েছে পেন্সিল দিয়ে টনসিলার ফসাকে খুঁচিয়েছে, নেক ট্রমা হয়েছে। তাহলে লেফট সাইডে তার হেমিপ্লেজিয়া হয়েছে। কি সমস্যা হয়েছে, কি কোথায় ড্যামেজ হয়েছে, কোন আর্টারি ড্যামেজ হয়েছে? সব জ্বলে যাচ্ছে নাকি আমি বুঝতে পারছি না। সব জ্বলে যাচ্ছে না কিছু ঢুকছে, জ্বলে যায়নি। বস জরুরি ক্যারোটিড আর্টারি ইনজুরি, আমি তোমাকে এটা বলে সবচেয়ে সোজা বলে দেবে স্যার, ক্যারোটিড আর্টারি ইনজুরি। এ বললাম যে এত করে বাবা বলেছি তো এটা। Child presenting with recurrent hemiplegia diagnosed with intracranial arterial stenosis. না এটা না, এটা ভুল আছে, এটা হবে। সিকেল সেল লাটেরাল স্টেনোসিস করতে পারে, কিন্তু এটা অ্যান্সার হবে, ক্যারোটিড স্টেনোসিস। এটা কারেকশন আমি করেছিলাম, কিন্তু তার আগে মন্দিরা দিয়ে দিয়েছে, এটা মন্দিরাকে পাঠিয়ে দিয়েছিলাম, দিয়ে দিয়েছে। তারপর আমি আজকে আস্তে আস্তে পাওয়ার পয়েন্টটা থেকে কারেকশন করতে চেয়েছিলাম, কিন্তু তখন তো অলরেডি চলে গেছে এটা। এটা কারেকশন করে লিখে দেবে, হ্যাঁ ব্যাস। আচ্ছা, প্রেজেন্টিং রেকারেন্ট ট্যানজেন্ট ইস্টিমেটেড উইথ প্রোগ্রেসিভ হেমিপ্যারেসিস, হেডেক, অরা অ্যান্ড ট্যানজেন্ট। ভেরি গুড। পোর্ট ওয়াইন স্টেন স্ট্যাচু। হ্যাঁ হ্যাঁ, বলো বলো। মোহাম্মদ একটা, আর একটা কি হতে পারে? মোহাম্মদ চ্যানেলোপ্যাথি।